CBS News medical contributor Dr. David Agus joins us now with more on the coronavirus pandemic. Doctor, good morning to you. What is most concerning to you about the recent surge of cases in some of these states, and do you see more states at this point now slowing down their reopenings?
Jeff, yeah, it's a scary time. I mean, we're certainly seeing rising number in many pockets of the country. It's predominantly younger individuals. The problem is they then come home and spread to their parents, their grandparents, their neighbors, et cetera. And so every person who has the virus is spreading it to more than one person. So when numbers are going up, numbers will keep going up and at a much more alarming rate over time.
Dr. A, it's Michelle here. While cases are up in certain areas, the rates of new deaths are down. What's the correlation there?
Hey, Michelle, you know, the problem of this rise is that, or the good of this rise is that a younger generation. Younger generations classically can get the virus, can be mildly symptomatic, but are not going to be hospitalized at a lower death rate. So that's why we're seeing those numbers. And also, there's also a delayed many times on the death rate. The problem is, again, those younger people can spread to others. So unless we intervene, unless we start to do social distancing, contact tracing, and wearing masks, it's not going to change.
Dr. Agus, it's Dana now, and you just mentioned that younger generation. Give us some sense. We're seeing the data that has a lot of these new cases being from the younger generation. What does that mean?
Well, you know, in inning one, we knew the rules, right? Stay at home. We all did that, and we did great. Inning number two is, well, the rules are different all over the place. It's not clear what is right. And that younger generation especially is saying, hey, forget it. I'm just going out. I'm going back to my normal. I can't stay in anymore, and so I'm going out, and I'm not going to listen to wearing a mask and social distancing. They're catching the virus and spreading to others. You know, it's very frustrating from a public health side. It's very frustrating to the citizens who are doing the right thing because the virus is spreading in many pockets of the country at a tremendous rate.
You talk about them going out more and the idea of wearing a mask, regardless if you are out more as people are now. It's something you and I emailed about this week. If you're out around a group of people or if you are traveling, how long should you wait after that to get tested to potentially, I guess, get the best result?
Well, I think the period of exposure is exactly what you're asking. And so when you're exposed, there's a period where you could get the virus, anywhere from 2 to 14 days later. In general, it's in that first week, but it depends how much of the virus you were exposed to. People are exposed, we think, to a lower level of virus. Many times it can take 10 or 12 days before they are symptomatic and before you can test positive. So it's a longer period, which is why we had that 2-week stay-at-home period, the 2-week quarantine in many countries when you go there, or in many cities, or in the state of Hawaii. It's because of that 2 to 14-day window.
You know, yeah, I saw some of the numbers up there. We talk about the coronavirus test and then the antibody test, and I think we talked about this a lot a couple weeks ago. But are there any new indications with some of the antibody tests that we may know more from them, or are we still in the same place that we've been?
When you get a virus, there are two ways you fight it. One is make antibodies. The second is T cells. Well, when you measure one half of it, it tells you a piece of the story. And most of the tests on the market measure all of your antibodies to coronavirus, including prior ones. They don't measure ones to the spike protein that block the virus from getting in, what we call neutralizing antibodies. So the antibody tests are a piece to the puzzle, but they do not show you immunity. They show you prior exposure. And it's really important because we don't know how long immunity will last. We don't yet have the ability to quantify immunity. My hope is science will catch up and we'll be able to do that because that's going to be critically important as we go forward. And especially as we look at opening schools and workplaces open more, is to find who is immune before we get the vaccine and we can make everybody immune to this virus.
Exactly what I was thinking, Dr. David Agus. Thank you so much.